Hi, everyone. I'm Dr Coryell. I'm a board certified internist, and I am interviewing Dr. Patel. And we are actually speaking about COVID-19. I will let Dr. Patel introduce herself because she has a pretty extensive and impressive background that warrants her getting on here in this interview and giving advice to you all.
Great. Thank you, Dr. Coryell. So I'm also a general internist, and I practice in the Washington, D.C. area, and I have also a bit of background and experience in pandemic preparedness. I worked in the White House for President Obama on a number of healthcare issues, including our H1N1 response. And then prior to that, worked in the United States Senate for Senator Ted Kennedy from Massachusetts, working specifically on actually our country's infrastructure through the FDA, through the CDC, and through a number of other kind of measures on dealing with multiple pandemics, including early HIV crisis, all the way to kind of flu pandemics. So this is kind of a very, as you mentioned, I hope for our country, very kind of confusing times. And I hope that together today, two of our voices can bring a little clarity to that confusion.
Wonderful. And thank you so much for joining and for doing this. I know a lot of my followers, but just people in general, need to hear from more physicians on the front lines and hear more advice that's substantiated by obviously evidence-based medicine, at least as much as we have right now, given
Right.
the COVID spread. Okay. So when do we need to call a doctor versus when do we need to go to the doctor?
Right. Great question. One that we're getting a lot, by the way. So people who we are now seeing in this country community spread. So it's now just person to person contact, not necessarily because of travel to a certain area, et cetera. So I would strongly encourage you to call your doctor's office first, always, even if you're just confused and wondering what you need to do at home to stay safe. But I would say at a minimum, call your doctor if you have been told that you have been in contact or in a location where there have been confirmed cases, and you are also starting to develop any sort of symptoms. I would like to tell you that from the evidence we know, Dr. Coryell, that it's really fevers, more of a dry cough. But instead of trying to navigate that yourself, it's always best to call. And then when I would say you need to get physically to today, unfortunately, we still need to physically go somewhere to get tested. We do not have at this moment today, Friday, March 13th, we do not have a way to test ourselves safely in our home. I know that people are working on that, but I would say that you really need to go to a clinic if you feel like you have to be tested. And I think, again, I would say it would be if you know that you were in kind of an area or a person that had confirmed cases, as well as symptoms. And again, the symptoms could vary from you have a low grade fever to just a cough. But I would say, if possible, call first. Now, I'll say another thing, though, Dr. Coryell, that we have a lot of patients, you and I as internists, that have a lot of other chronic medical conditions. And we do know from our data to date that persons over the age of 50 are at higher chances of having serious consequences from this. So if you are at higher risk and you are starting to experience symptoms that are really concerning, I would say make sure you get to a healthcare worker as quickly as possible and do not delay just because it's a Sunday or a Saturday.
Good pieces of advice. Now, if you have symptoms and you are told to quarantine at home, can you tell us exactly what that means?
Yeah,
I know a lot
yeah.
of people are just confused, like they told me to quarantine, so I just closed the door and stay
Right.
indoors.
Right. And that's what I've heard a lot of people are doing. A lot of people are telling me, well, I was told by the doctor to quarantine. And so I'm just staying in the house. That alone is not good enough. And here's a really simple analogy. Think of it like having lice, and you have to really be careful about washing your clothes, your sheets, anything that you come in contact with could be a way to give something to somebody. So if you're in a home like I am with children and other adults, you need to actually try to limit yourself to a 1 or 2 rooms, a room with a bathroom that you do not share with anybody else. You need to limit physical contact. Also, something people don't think about, you need to limit the contact your dishes and your food have with other people in the household. So I would recommend you kind of think of it as you have lice, you're in a room, and you really shouldn't leave unless you need to. And when you do, you have to be really conscious of anything you're touching that other people in your household could touch. So it's not a trivial matter. And I do feel like as we're getting more new confirmed cases that we are told to self-quarantine, we just need to think about it differently.
Absolutely. Great advice as well there. Now, last question, just because we want to keep it brief, what do we know currently about treatment?
Yes. So there are no current FDA approved treatments for this novel coronavirus. That's partly why it's called novel. There is an investigative drug that's available under compassionate use only. What does that mean? It means that if you are unfortunate and are in a hospital, the hospital's doctors have a way of contacting the Food and Drug Administration and getting kind of rapid acceptance, like within hours acceptance to use this drug. But this drug is not widely available, and it's not something that I can go and prescribe, or you and I can go and just prescribe. So unfortunately, we do not have a treatment. Everything we're doing is what we call supportive care. And it's a kind of a grab bag of things that as doctors we have used in the past for atypical pneumonias. But the bottom line is part of why I think the country is taking social distancing and some of these other measures seriously is because we don't have a treatment. For me as a mom, when Disneyland closed, I knew that was a signal that this is serious and we don't need to panic. You know, I want people to hear that it's normal to be anxious about this, but do not let it dominate your day. Try to think about this as a chance to actually just reconnect with the people you love in a very different way. But it is serious. And I think you and I, that's again, another, when you do see your friendly neighborhood healthcare professional, let them know that you're thinking of them, because all of us that are going into clinics and hospitals are always worried about our patients, but we're also worried about the society we practice in.
Yeah, and that's really a wonderful thing to do and something we need to stress, because
Yeah.
I've seen a lot of people saying, well, don't worry, it won't affect us. You know, people that are sort of younger. And I
Mhm.
don't think that that's fair. Again, it's,
Yeah.
first of all, it doesn't seem to be affecting just the older or immunocompromised
Right.
population, but also like we care about that population.
Right.
So
That's
I'm
right.
there with you. All right. Thank you so much for joining and for making this video.
Thanks, Dr. Coryell. Take care.